Vaccination Fact Sheet COVID-19. Instructions for COVID-19 vaccination providers. COVID-19, coronavirus disease which appeared late of 2019. It is an infectious disease caused by SARS-CoV-2. It is predominantly a respiratory illness that can affect other organs. COVID-19 symptoms ranges from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms include fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Contraindications: do not administer Pfizer BioNTech COVID-19 vaccine to individuals with known history of a severe allergic reaction, e.g. anaphylaxis to any component of the Pfizer BioNTech COVID-19 vaccine. Warnings: appropriate medical treatment used to manage immediate allergic reaction must be immediately available in the event an acute anaphylactic reaction occurs following administration of Pfizer BioNTech COVID-19 vaccine. Monitor Pfizer BioNTech COVID-19 vaccine recipients for the occurrence of immediate adverse reactions according to the Centers for Disease Control and Prevention guidelines. Immunocompromised persons, including individuals receiving immunosuppressant therapy, may have a diminished immune response to the Pfizer BioNTech COVID-19 vaccine. Pfizer BioNTech COVID-19 vaccine may not protect all vaccine recipients. Administration: visually inspect each dose in the dosing syringe prior to administration. The vaccine will be an off-white suspension. During the visual inspection, verify the final dosing volume of 0.3 ml. Confirm there are no particulates and that no discoloration is observed. Do not administer if vaccine is discolored or contains particulate matter. Administer the Pfizer BioNTech COVID-19 vaccine intramuscularly. After dilution, vials of Pfizer BioNTech COVID-19 vaccine contain 6 doses of 0.3 ml of vaccine. Low dead volume syringe and/or needles can be used to extract 6 doses from a single vial. If standard syringes and needles are used, there may not be sufficient volume to extract a 6 dose from a single vial. Irrespective of the type of syringe and needle, each dose must contain 0.3 ml of vaccine. If the amount of vaccine remaining in the vial cannot provide a full dose of 0.3 ml, discard the vial and content. Do not pull excess vaccine from multiple vials. Thawing prior to dilution. Thaw vials of Pfizer BioNTech COVID-19 vaccine before use, either by allowing vials to thaw in the refrigerator 2 degrees Celsius to 8 degrees Celsius, 35 degrees Fahrenheit to 46 degrees Fahrenheit. A carton of vials may take up to 3 hours to thaw, and thawed vials can be stored in the refrigerator for up to 5 days, 120 hours, allowing vials to sit at room temperature up to 25 degrees Celsius, 77 degrees Fahrenheit for 30 minutes. Using either thawing method, vials must reach room temperature before dilution and must be diluted within 2 hours. Before dilution, invert vaccine vial gently 10 times. Do not shake. Inspect the liquid in the vial prior to dilution. The liquid is a white to off-white suspension and may contain white to off-white opaque amorphous particles. Do not use if liquid is discolored or if other particles are observed. Dilution. Obtain sterile 0.9% sodium chloride injection USP. Use only this as the diluent. Using aseptic technique, withdraw 1.8 ml of diluent into a transfer syringe, 21 gauge or narrower needle. Cleanse the vaccine vial stopper with a single-use antiseptic swab. Add 1.8 ml of 0.9% sodium chloride injection USP into the vaccine vial. Equalize vial pressure before removing the needle from the vial by withdrawing 1.8 ml air into the empty diluent syringe. Gently invert the vial containing the Pfizer BioNTech COVID-19 vaccine 10 times to mix. Do not shake. Inspect the vaccine in the vial. The vaccine will be an off-white suspension. Do not use if vaccine is discolored or contains particulate matter. Record the date and time of dilution on the Pfizer BioNTech COVID-19 vaccine vial label. Store between 2 degrees Celsius to 25 degrees Celsius, 35 degrees Fahrenheit to 77 degrees Fahrenheit. Discard any unused vaccine 6 hours after dilution. Preparation of individual 0.3 ml doses of Pfizer BioNTech COVID-19 vaccine. Using aseptic technique, cleanse the vial stopper with a single-use antiseptic swab and withdraw 0.3 ml of the Pfizer BioNTech COVID-19 vaccine, preferentially using a low dead volume syringe and/or needle. Each dose must contain 0.3 ml of vaccine. If the amount of vaccine remaining in the vial cannot provide a full dose of 0.3 ml, discard the vial and any excess volume. Administer immediately. This information and visuals were retrieved from the FDA.gov.